Sometimes the toughest people suffer in silence, but that silence can lead to misunderstanding and even frustration from those caring for them. That's exactly what happened to one person recovering from a serious car accident who chose to refuse pain medication, only to be publicly labeled a tough guy by a nurse. But here's where it gets controversial. Is stoicism in pain really something to be applauded, or is it a barrier to proper care? Dear Eric, after being hit hard in a car crash and losing consciousness, the first thing I remember is waking up in the hospital confused and disoriented. When a nurse asked if I wanted something for the pain, I said no. Moments later, I overheard her telling others, "He's a puff guy, doesn't want any pain meds." Throughout my 2-week hospital stay, staff kept bringing up that I was trying to be tough. Honestly, I never considered myself someone with a high pain threshold. I'm not sure how to react to this judgment at all. No pain, dear, no pain. It's clear there was a communication breakdown here. Nurses and all medical professionals owe it to their patients to treat them with kindness, understanding, and respect, especially when someone is recovering from something as serious as a head injury, which can affect their responses and clarity. Perhaps your refusal wasn't about being a tough guy, but rather a moment of confusion or uncertainty about what you needed. This is why empathy and open dialogue are essential. A surprising number of patients suffer from their pain being ignored or minimized in healthcare settings. Research highlights that groups such as older adults, women, and non-white patients often receive less adequate pain treatment than others. This uneven treatment underscores the necessity of having advocates, family members, or friends to help express your needs and ensure you get the care you deserve. Interestingly, empathy must work both ways. Nurses, who are the backbone of hospital care, face incredible stress themselves. According to a survey by National Nurses United, the largest U.S. nurses union, over 81% of nurses experienced some form of workplace violence in 2023. When we are at our worst, dragging ourselves into a hospital, it's important to remember that healthcare workers are not the source of our pain. They are the ones trying to alleviate it. They often work extremely hard under challenging conditions and typically earn less than what their dedication warrants. That said, if you feel unheard or mistreated, don't hesitate to seek support from another staff member or bring someone along who can support your voice. Being patient is one thing, but making sure your care is respectful and responsive is another entirely. Does this raise an uncomfortable question? Should patients always be expected to assert themselves to get proper pain management? Or do healthcare systems need to change how they approach patient pain and communication? Share your thoughts. When is being tough helpful? And when does it prevent you from getting the care you need? You can send your questions to R. Eric Thomas at eric@askingeric.com or P.O. Box 22474, Philadelphia, PA 19110. Follow him on Instagram and sign up for his weekly newsletter on his website. Copyright 2025 Tribune Content Agency, LLC.